Welcome to the Burn Aid channel. Thank you for joining us. Today, we'll discuss first aid for chemical burns. Chemical burns can be serious and require immediate attention. Let's go over the steps you should take to provide effective first aid for chemical burns. Understanding chemical burns. Chemical burns occur when skin or eyes come into contact with corrosive or irritating substances. These burns can cause deep tissue damage and may not show immediate symptoms. Recognizing a chemical burn quickly is crucial for minimizing harm and initiating proper first aid. Immediate action: remove the chemical. The first step is to stop the burning process by removing the chemical from the skin. If the chemical is a dry powder, gently brush it off before rinsing with water. Avoid using your bare hands to remove the chemical. Use gloves or a cloth to protect yourself. Flush the area with water. Rinse the affected area with cool, running water for at least 15 to 20 minutes. This helps to dilute the chemical and wash it away from the skin. Do not use ice or very cold water. Continue flushing even if the pain subsides, as the chemical may still be causing damage. Special considerations for specific chemicals. Certain chemicals require special first aid considerations. 1. Quicklime, calcium oxide. Brush off the substance before flushing, as water can cause a dangerous reaction. 2. Hydrofluoric acid. Flush with water, but apply calcium gluconate gel as soon as possible. 3. Sulfuric acid. Be cautious, as adding water can cause an exothermic reaction. Dilute carefully. Remove contaminated clothing and jewelry. Remove any clothing, jewelry, or accessories that have come into contact with the chemical. These items can retain the chemical and continue to cause burns if not removed promptly. Be careful not to spread the chemical to unaffected areas while removing clothing. Cover the burn area. After flushing, cover the affected area with a clean, dry, non-stick bandage or cloth. This helps protect the burn from infection and reduces further irritation. Do not apply creams, ointments, or home remedies unless instructed by a healthcare provider. Seek immediate medical attention. All chemical burns should be evaluated by a healthcare professional as soon as possible. Call emergency services or go to the nearest emergency room, especially if the burn is large, deep, or on the face, hands, feet, or genitals. Provide information about the chemical involved to assist medical personnel in their treatment. Avoid further exposure. Ensure the area where the burn occurred is well ventilated to avoid inhaling fumes. If the burn occurred in a confined space, evacuate the area immediately and seek fresh air. Be aware of the potential for chemical residue to remain on surfaces and cause further exposure. Monitor for signs of complications. Chemical burns can lead to complications such as infection, scarring, and systemic toxicity. Monitor the burn for signs of infection, including increased redness, swelling, or pus. Seek medical advice if you notice any worsening symptoms or if the burn does not appear to be healing. Long-term care and recovery. Follow your healthcare provider's instructions for ongoing care of the chemical burn. Keep the burn area clean, dry, and protected as it heals. Attend all follow-up appointments. If needed, consider counseling or support groups to help cope with the emotional impact of the injury. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the BurnAid app for free from the Play Store or App Store for more detailed guidance on burn care and first aid.